Dr. Toyos here. We're talking low-level light treatment for dry eye disease. Just like intense pulse light, IPL, these wavelengths of light stimulate the glands to work better. Turns out the best wavelength of light is red, and that's what we're trying to get out of intense pulse light. That's why we put a filter to block out the other levels of light. And red in LED works the best. Blue works as well, not as strong as the red light when it comes to dry eye disease. And then infrared actually helps symptomatically because it helps with nerves and decreasing nerve irritation. Now, what's the best way to deliver that light? So just like intense pulse light, if we're going to be an inch away, we're not going to get as much energy into the dermis and into the meibomian glands. There's the inverse law where the further away you are from the skin with these light treatments, the less energy is absorbed and more of that light energy is not focused in on the area and actually goes away from the area that you're trying to treat. So the best way to treat is by using a device right on the skin. So that's why we put IPL in the skin. That's why we put our low-level light treatment on the skin. Now, where does a mask fit in? Now, a mask, you're using a lot of energy to get there. You're going to have to stay there longer. So as with the Q, you only have to be there for a couple of minutes on the skin. With a mask, so we have our mask here. With the mask, it's going to be an inch away, and you're actually going to have to stay there for 15 to 30 minutes to actually get any kind of energy just to the epidermis. So it's really not a treatment for meibomian gland dysfunction and dry eye. It's really a treatment to help rejuvenate the skin. Now, one thing that we're working with is using nano micellar technology by having oxygen, a cream that has oxygen, that the LED lights help absorption into the dermis to help the meibomian glands work better and help with your dry eye. So you can do this as a treatment in office where you put the O2 cream and then you sit in front of a red light for 30 minutes, or you could do it at home where this deep O2 is placed on the lids and the face, and then you put the Q like you would normally use for dry eye disease, pushing in more oxygen to the tissues so that the tissues rejuvenate and work better.